An expert is urging Canadian universities and colleges to be proactive about preventing monkeypox from gaining a foothold on campuses. University of Manitoba virologist Kindrachuk says schools should be raising awareness about the risks of monkeypox. This comes as students prepare to come together this fall. The University of Toronto says no cases of monkeypox have been reported on campus, but it is providing students with resources where they can learn more about the disease. Toronto Metropolitan University says it is developing protocols to deal with potential infections on campus, particularly in residences. Meanwhile, many provinces have expanded vaccine eligibility. However, Professor Kindrachuk says more doses need to be rolled out. Now, this comes after the World Health Organization declared monkeypox to be a global health emergency in July. Well, joining us now to talk more on this is Dr. Kindrachuk himself. Sir, welcome to Forum Daily.
Thanks for having me.
Now, concerns around Canada's monkeypox vaccine supply had been brought up over a month ago, Dr. Kindrachuk. So what is the current state of the monkeypox vaccine supply in our country?
Yeah, the current status is that across the globe, we're in a pretty dire situation in terms of the number of doses of the Jynneos vaccine that we have, which is unfortunate, right? We have to appreciate that there has been a rapid need for expanded use of the vaccine, but the unfortunate reality is we didn't have a lot of doses to spare already. So where we are right now is trying to strategize of how to be able to provide doses to countries that are seeing high rates of transmission, to be able to provide proactive protection from the virus, but also to appreciate that we have an ongoing decades-long situation in Central and West Africa that clearly we have not provided enough resources for.
Now, taking a look south of the border, we know the FDA recently began stretching their vaccine supply into smaller doses. I believe 1/5 of a dose is being administered. So how efficient is this vaccine if only 1/5 of a full dose is given to people?
Yeah, so this becomes a bigger question about what do we know about the vaccine. Listen, the Jynneos vaccine, much like the vaccine that preceded this, the ACAM 2000 vaccine, we don't have a lot of clinical efficacy data directly against this virus. And part of that is because we haven't seen large outbreaks of this virus on a global scale in the past. So most of our assessments of efficacy have been based on comparisons back to the original smallpox vaccine, Dryvax. Now, for the Jynneos vaccine, when we compare that back to ACAM 2000, we've seen really good immune response. That gives us a good indication the vaccine is working. The reduced dosing and certainly the strategization of how to be able to dole out those doses more effectively seems to be lining up with data. It's the protection part that we still are trying to better understand. And that's going to take, unfortunately, some time right now.
So do you think Canadian officials should consider this kind of strategy in our country?
Well, we're in a situation of trying to figure out how to best get vaccines out to Canadians, especially those that are being overrepresented in current cases, but also appreciate where current case trends are going. We've seen certainly some data and some trends over the past few weeks that suggest we're seeing some plateaus in areas and maybe even decreases in cases. This becomes a question of, okay, what happens next? Are we able to get control of this through public messaging, through changing societal behaviors and a very focused vaccination strategies, or do we still need to go wider? And I think that's really a bigger question for those that are in the public health sphere to address with the data they're seeing on the ground.
Now, meanwhile, you're encouraging universities and colleges in particular to be more proactive about preventing monkeypox. So tell us a little bit more about how at risk these campuses are in terms of the upcoming fall semester.
Yeah, it's a great question, right? So when we look so far at what we've seen in regard to transmission, the majority of these cases continue to be related back to sexual contact in some way, not necessarily directly related to sexual transmission itself, but certainly the act or the close contact, and then as well within the MSM community. We need to appreciate these are not the only communities that are impacted by the virus, but the current risks outside of those networks still appears to be quite low. The problem is that we don't necessarily know what happens when we start putting people into closer contact, and certainly when we may see a greater spread of virus through sexual networks. So I think a big part of this is ensuring that people that are going back to school, those that are highly sexually active or who are sexually active at all, whether they fall in the MSM community or otherwise, they have access to resources that they need, and certainly to outreach centers should they need to be able to get additional questions addressed.
All right, Dr. Kindrachuk, we are out of time, but thank you again for a great informative interview. Thank you again.
Thank you.
All right, stay with us. After the break, we'll be taking a look at more news from around the world, starting in Russia. So stay tuned. We'll be right back after the break.